Darren Johnson, and I'm the professor and chair of orthopedic surgery and the director of sports medicine. I don't cure cancer. I'm not saving lives. In my small little world I live in sports medicine, we get to see a lot of high school, college kids who have this injury. So say they blow out their knee and tear their ACL, which is sort of my expertise, if you will. So you see them in the office, tears. Mom's got tears, dad's got tears. And for the child, teenager, not child, it's like the end of the world. They blow out their knee, and all of a sudden some doctor's coming in telling them they need surgery, and you're going to be out 8 months, and what's going through their mind is, I'll never be able to get back on the field. We take care of all the UK athletes, and just because they're college kids does not mean they're not kids. So they have this injury, and you almost see them at their lowest point, if you will, because most of them have not had that event. And I think for me, personally, is that you operate on them, you go through the rehab process. Like when that player goes back on the field, score a touchdown or whatever, and you get to see them at their lowest and back to doing what they love to do, can't beat it. Can't beat it. If you grow up in Los Angeles, even though there's UCLA and USC, which, big deal, but it's not a college sports town. And then moving here, this is a college sports town in every sense of the word. So over the last 23 years I've lived here, I've become much more of a college sports fan. Obviously, particularly since Coach Cal's been here, Big Blue Nation, college basketball, wife, kids, all enjoy it. I'm also a little impartial just because I take care of the college football team, so I'm very much a college football fan. I'm a little bit of a workaholic. I don't have a lot of hobbies, so I still like to work. I see a lot of patients and I do a lot of surgeries, and people always say to me, well, Darren, now that you're the chair of the department, most chairs don't work like you do. They go to meetings, take it easy now. Darren, you're 54, you're a little bit older, but the patient care part is the reason I originally got into it. So if I ever had to take that away, it's a different job for me. I didn't sign up for that. I mean, that gives me, that's my hobby. Now I got to get some more hobbies, my wife tells me, so I'm working on that, but I love what I do. So I'm pretty lucky. There's a lot of physicians, I think, probably that might not love what they do. You know what I mean by that? It's a job. This is not a job to me. This is sort of my calling.